stay in bed 10 to 15 minutes after sexual intercourse. Calculate and know your fertile period. Monitoring your vaginal secretions. To get an ovulation tester. Infertility is a major cause of alarm among people of childbearing age. We have young people asking so many questions about their infertility problems. We have people blaming themselves, some even taking things that would even further affect their fertility. In the part of the world where I come from, in Africa and Nigeria, specifically where I come from, married couples who do not have children after 2 to 3 years are sometimes mocked or even scorned. So infertility is like a major problem where I come from. Most times, infertility is not self-inflicted. The female reproductive system is very tender and delicate, just like the woman. And so any affectations or underlying conditions can actually affect it. So in this video, I will just be listing underlying conditions that affect infertility. So stay tuned. First on my list is structural abnormality. One of it is blockage of the fallopian tube. Then we have abnormally shaped uterus. This can affect implantation of the egg. Fertilization might actually occur, but there will be problem of implantation because the uterus is actually abnormally shaped. Next is hormonal affectations. Any hormonal issues that affects the female would definitely affect fertility. We have polycystic ovarian syndrome. We have many other hormonal issues. We also have PID, which is pelvic inflammatory disorders, and also other sexually transmitted infections that have been left untreated: gonorrhea, syphilis, chlamydia. Next is uterine fibroid. We know how bad fibroid is. Depending on the location of the fibroid and the size, you could even lead to permanent infertility, okay, until the fibroid is taken out or until it shrinks, which is really hard. Next on my list is endometritis. Okay, this is a condition or a disorder where tissue similar to that lining the uterus grows in other parts of the body. Okay, it's a very serious condition, and if you have any interest in it, you should check it out and research also about it. So let me tell you also another group of people that are experiencing infertility issues. This group of people have nothing wrong with them, the female or the male. Some of them have gone to health checkups and has been certified by their healthcare provider and their doctor that they're actually okay, nothing is wrong with them, they're just supposed to try. Now, if you're among this group of people, stick to this video and watch it to the end. I'm going to be sharing tips that can actually boost your fertility journey. First and very important on my list of tips to boost fertility is to calculate and know your fertile period. Okay, you could do this by using the calendar method. This is by calculating your menstrual cycle. Okay, calculate it well enough to be able to predict your fertile period. Okay, you could predict it, you know when it's going to happen, and you prepare yourself towards it. Okay, you could also calculate your fertile period by monitoring your vaginal secretions. I don't know if you know how this is done, but it's quite very easy, and I'm hoping I do a video where I talk about the female secretions and what each of the texture of it and the color and consistency means. Okay, so you can actually predict your fertile period just by monitoring your vaginal secretion. Okay, another one is to get an ovulation tester, which will help you know when is the ovulation. Okay, it's better you pair it with maybe the calendar method, that way you don't get to be testing every time. But then an ovulation tester is like a lifesaver. It's sold in most supermarkets and even in some pharmacies. Some hospitals also recommend, so you can find it over the counter. So next on my tips is diet and healthy meals. Some of us don't know how very important it is to balance our meals if we are hoping or we're on this fertility journey, you should actually look at what you're eating. Eat foods that are good on vitamins, minerals, eat foods that are good on foliate. We know how important it is to take folic acid if you want to get pregnant. You should eat veggies, a lot of veggies also. Avoid caffeines because they are not very important. I don't see the big deal in caffeinated drinks and all. Then avoid alcohol, okay? And then if you think your dietary feeding or your dietary supplements are not enough, then you take over-the-counter supplements. They're actually very effective too. So you could buy vitamins over the counter, buy folic acid over the counter, buy Vit C and other vitamins that are very important over the counter, and take them after each meal, okay? Follow instructions, and they really help in fertility journey. Another very important one is weight. You should actually balance your weight. We know the WHO standard BMI, body mass index. So research on that and see that your BMI is within the normal range. Okay, it's actually very important. I am not saying that if you're overweight you can't be fertile. I'm just saying that you should actually look at your weight and see how you can balance it so you could be at the healthy side. So next on my list is to stay in bed 10 to 15 minutes after sexual intercourse. Yes, you heard me right. This could actually help the sperm to do its natural line of action, the body to do its normal line of action. So it could help the sperm climb up and it could actually boost fertility. Finally, do not overdo it. By this I mean that it's not necessary to have sex day and night. Have sex in the day and have sex in the night while you're trying to conceive. That's because it's not really necessary. However, it is okay to have sex often when you are at your fertile period, okay? This is quite logical because you're at your peak, so you would try. It's okay to want to have more sex during that period. Again, I'll also add, take time to rest, relieve stress, and take your mind off the whole fertility journey. The truth remains that sometimes when your mind is not even there is when you conceive. So relax, ease yourself of stress, take good diets, have sex, calculate your fifth period, and if you're religious, maybe you can pray about it. If you have sticked around to this video up to this time, please subscribe to my channel and please give my video a thumbs up.